member feels supported when the member knows what's going on. So lawyers will explain to the doctor what the steps are, will explain the stress associated with each of the steps, and will invite discussion on what the doctor feels.
So it begins with communications, and there's also a need for transparency in there. Transparency means that we are very forthright with the physician in terms of what he or she can expect over the next several months and sometimes years. Legal action, unfortunately, is a marathon, it's not a sprint. It takes some time to resolve these issues, and no matter how much we try, sometimes it just takes time.
When there's a medical legal problem, physicians become very anxious. They become embarrassed. They start losing sleep. They second guess themselves. They have problems trusting their judgment.
Most physicians actually feel quite stressed, and it tends to affect them professionally and personally. A lot of times they worry that they've made a mistake, or that they're incompetent, or that they're going to lose their license.
Certainly having a medical legal action, a lawsuit or a complaint, or sometimes a series of complaints can be devastating for a physician. It makes them question themselves, it makes them question whether they even want to stay in practice. And so we always tell the physician to sort of take a pause, discuss what their feelings are, what their anxieties are with us.
It's very important for physicians to let us know if they're having trouble coping with the situation, because we can then direct them to available resources. Fear of the unknown causes a lot of anxiety and stress in human beings, and I've noticed that physicians sometimes hold back some of their questions because they're embarrassed.
And the best way to address these questions is to put them on the table and to invite the physician to talk about how he or she feels, so that we can have a discussion about it.
But in my view, that's probably not enough. I think that they need to have somebody on the outside as well, whether it's a trusted friend, a spouse, or best of all, probably a peer that they can speak to.
Obviously, lawyers are not counselors, but lawyers will have access to a network of people who can help the physicians. The doctors at the association can also help the physicians when they phone.
And it's really important for physicians to realize that most physicians in Canada will encounter a medical legal difficulty in their career. And even more, I want to reassure them that even the most caring, competent, and knowledgeable physician can face a legal matter at some point in their career.